All right, welcome to another episode of Medicine Mondays. I'm yours truly, Dr. Pierre, your favorite board certified internist, host of Medicine Mondays, host of The Real Physician Reacts. And I know it's been a while, y'all. I know y'all been asking. We have a special guest on the show today. This is actually someone that I've probably known for about, this is
12 years, because we used to walk the hallways.
I know it's
like, hi.
The time is just moving, right? And I recently saw her. She's now a doctor of she's a nurse practitioner, specialized in neuroscience. And I saw she was doing this thing called Neuro Nuggets, and I said, "Oh, I need to get her on my show." Like I said, you know what, this is a person that I want to just kind of highlight because, and you know how we do on our show, when we see people, especially in our healthcare field, wanting to educate, wanting to promote their field, their education, while bringing their own personal touch to it, we want to make sure we highlight it to the masses, right? So Dr. Kettia, first of all, thank you for joining this week's episode of Medicine Mondays, and appreciate you for having us.
Thank you for having me. This is an honor, as I am very nebulous in this stage of tapping into being a healthcare content creator. So I'm very honored, and I appreciate you popping my cherry.
I love it. And it's so interesting because we talked about this a little bit offline, like, because like I remember when I first started.
And yes, I remember. Yes.
Going through that said journey. So I just love when I'm able to offer any type of assistance that I can to get people out there, especially when I know they're doing beautiful and absolutely amazing things. So first and foremost, right, question, right off the bat, right, especially people don't read the description, they don't get your bio, because I got a lot of people, they don't read my descriptions. I wish I could say that.
It's human. It's right. Like, what are the quick bullet points?
That's 100%, right? So who's Dr. Kettia? Like, who are you, and how do we get to this point where we're at now?
So my origin story starts out of Immokalee, Florida. It's a small town outside of Naples. So most people know Naples, Miami, Fort Lauderdale, like the main cities. Yep. Immokalee is a small town. I'm not sure what the population size is, but basically it's an agriculture town. So there's a lot of immigrants, a lot of migrants that work in the fields and stuff. So if you've had some produce from Whole Foods, sometimes your tomatoes, because it lists the town it's from, you may have had Immokalee tomatoes. So I'm first generation. My parents migrated here from Haiti, and I'm first of four. And so that's my origin story. Left the west coast of Florida, come to the east coast for school, and I have not left. Started at Florida Atlantic University. Then I went into the nursing program, my undergraduate program at Nova Southeastern University, where I met Dr. Berry. We used to walk the halls of HPD together in our early years of learning medicine, bright-eyed, bushy-tailed, and not knowing what the world, before COVID, before monkeypox, we didn't know, before Zika, Ebola. There's been quite a few things since we've graduated.
It's so crazy. As you say it, like, yeah, there's been some things that we definitely would not have no idea imagine while we were in school.
Yes. It's so funny because, people are asked this a lot when you're, prepping to get into nursing school, and it's, why do you want to be a nurse? And the question is valid, and it's interesting because as my career has evolved and as I've evolved into different roles, I should say, I still go back to the fact that I'm here to help patients. And tapping into where I am now, my origin story from small town to now, it's how do I tap into the skill set that I've slowly been building and have a strong foundation on, and how do I now utilize the internet to, show what I have to offer. So graduated from undergrad, did my bachelor's in nursing, worked at the bedside, started out as a neuro tele nurse. So I dealt with the strokes, acute strokes in the inpatient setting. I dealt with, acute altered mental status. If you got recently diagnosed with a brain tumor, then, I was at the bedside. Did that for a few years. Then I transferred into the neuro ICU. Did that, which was a little bit more acute care, high acuity, I should say, of care, and did that for a few years, and then decided I wanted to go back to school. The bedside is very rewarding. You do give back to the patients, you do care for patients. However, I felt that there was more that I could achieve. And I do miss bedside. I do miss some of the elements of it. Although I am very happy in the role that I am in now. So I decided to go back to school to get my graduate degree in nursing. And I decided I wanted to be a nurse practitioner. There's different tracks that you can do when you decide to go back to school. And I wanted to be a nurse practitioner. I decided to do the doctoral prepared program of nurse practitioner route, because there still is the master's level and there's the doctoral level. Now it can get very confusing to patients because whenever you say the word doctor, you associate that with a physician. However, the easiest way I can explain it is think of a PhD education person.
And that's something I always have to educate my patients as well. And again, it's the public perception for some reason, especially when you're in that building, only connects doctor to physician.
Correct.
Like they don't connect doctor to the nurse practitioner. They don't connect doctor to the pharmacist. They don't connect doctor to the physical therapist. Like for some, again, and I don't know whose fault it is, but like for some reason, they just do not connect doctorates with all these other professions when they got doctors walking around.
Correct. And I think nursing was probably the last to the table, because pharmacists have since, canceled out their master's level. They're all PharmDs. Physical therapists, I don't think there's any master levels. Nursing, it's we could do another episode on that if you would like. Yes. It's very convoluted with each level, because you have your licensed practical nurses, which are still very much like an RN. There's just some like intricacies that delineates them from being able to do certain things within their scope. Then for a registered nurse, they can be associates or they can be bachelor's prepared. Then you have nurse practitioner. It's a lot. So I decided to do the DNP only because I didn't want to go back to school. Honestly, I said, I'm doing this a lot. We are not turning back.
Definitely nothing wrong with that.
It was like, we're doing this in one shot. Originally, when I first started applying, I was applying to master programs and I didn't get in the first round. So I was like, okay. And then I think it was like 2 cycles later that I decided, let me just try a DNP program. Because at that time, most people were not pursuing the DNP because there is actually no compensation difference in the grand scheme of things, because providers, although I'm a provider, but there's nothing that says a doctoral provider versus a master's prepared nurse practitioner provider that they should be paid different. Ooh. And it just depends on the institution you work at. There may be some benefits somewhere else, but I have not encountered that. But having the doctoral,
that could be a whole discussion. That could be a whole discussion in itself.
I'm telling you, it's the nursing. I mean, how much time do you have? We can do it right now. So nursing is very convoluted. Although if I could do it all over again, I would do nursing. But because it is my profession, I believe I can speak on it. It's like if your family has drama, you can speak on your family.
You speak on it because you're in it. You're in the family, so you're allowed
in
to.
It.
Outsiders got to the outsiders got to relax, but the insiders, they can.
Yes, it's always out of love. It's nothing that to bring down the profession, because I love being a nurse. But having the DNP allows me to then decide if I want to go into the academics. I could be a professor. I don't need extra additional training and whatnot. And the only difference between a master's prepared nurse practitioner and a DNP prepared is that I had to do a dissertation, which we call the scholarly project. When I first started, it was considered the capstone, but by the time I was finished with my program, it was called the scholarly project, which is AKA your dissertation.
Haitian for this shit.
I actually did my project on the Haitian community and advanced directives. And let me tell you, it was very interesting.
Oh. So
Yeah.
for Lunch Learning community, you should know. I mean, last name's Pierre. I'm Haitian American as well, and that is such a topic. And mind you, because I take care of patients in the acute care center, long-term care center, and rehabs, and sometimes just approaching that discussion of advanced directives, like on the inside, they're like, "Oh no, that family is Haitian. Like, there's no point to do it." Like that is like a drawback, and that was some prejudice that some people have even in our systems. That with our particular community, there's really no point to discuss advanced directives because they're not letting no one go.
They are not. And the reason why I chose that topic was because at the time I was working in the Neuro ICU. So I saw a lot of time, and not just Haitian patients, this is across the board,
Oh yeah, definitely.
where family members are making some very hard decisions. And it was evident that you should have at least a conversation prior to. It is not at that time that it would be ideal. Granted, that's in the best case scenario. I have had many conversations with my parents, and let's just say I decided it would be worth the while to try to see about just changing their attitude towards the conversation, not necessarily saying that they needed to implement. However, it was very interesting because I did it at a Haitian church, which that was the way I could try to capture a lot of people at one sitting. And I had people stand up and just walk out. They're like, "What? I'm signing my organs." And I was like, "No, that's not what this is about." It's like, let's have the conversation, because if you don't have the conversation, then you leave your loved ones to then have to make that decision at a very, very delicate time.
Very tough
That's
time.
not ideal.
Yeah, and it's to the point where it's sometimes it's the indecision where I'm not gonna do anything because I don't want to be left with that burden of choice on me, or another person in the family who may disagree says, "Well, you let them so and so go. You should. Barry wanted to be here forever, and you said he could like having that discussion is so poignant because if you don't, a lot of your family members are not equipped to make that decision. They just aren't.
And then because I'm a healthcare provider, this is where the DMP portion comes in. We consider, how does this then have a snowball effect within the whole healthcare system? So granted, if you want to do all life-saving techniques and then decide to peg and trach your family member, that's fine. However, what is the cost at the end of the day? And are you prepared to then see the quality of life of your loved one being at the mercy of other people? So that was why that topic was so important for me at the time, was as I'm studying DMP, and like we're supposed to be thinking of the whole healthcare system, like how do we save dollars? Because a lot of times dollars are wasted by people going into these long-term facilities and getting poor outcomes, such as pressure ulcers and different things that family members don't consider. And it's like, you just want to keep that person with a pulse, but you don't know what that pulse may equal down the line. And it's very raw. It's very like, no one wants to think about that. No one wants to think about those situations. But that is what my program trained me to do as a DMP nurse practitioner. I should be thinking at, all things holistically. And it's not what you're seeing today right now. It's like, how does this affect long term? So that being said, I've always kind of stayed in the neuro realm.
And did you just kind of luck up into it? Because I know you started out at bedside in the neuro tele. Was it at the time you're like, I'm kind of interested in this, or it was just like, this kind of where they started me?
My whole resume is geared to neuro. And I joke with my friends, the only thing that will make me leave this specialty is maybe aesthetics, maybe. However, I do not see myself leaving, because when I did neuro ICU, I saw it from the neurosurgery standpoint. So not only like we see you treating you with the protocols of stroke, I see if you get diagnosed with a glioblastoma, like what does that mean in terms of nursing care at the bedside, post-operatively or pre-operatively preparing you. So that being said, I have always geared, and when I was getting ready to get my first nurse practitioner job, I was only looking for neurology positions because I know the language.
Right.
And I love
You just been so encompassed with it that it just makes sense that like, okay, yeah, this is so while you're doing the DNP, you're like, it's definitely gonna be in
neuro.
like, okay, interesting.
Unlike the physician route, we do not have well, there are, let me backtrack. You rewind. So unlike the physician route, it's not mandated for nurse practitioners to do residencies. There is a new wave, and I believe at Duke, they have a program. I'm not sure if another major institution has a program as well, where they train the nurse practitioner in a residency format. So
Interesting.
yes, and it's actually really good because as a nurse transitions into provider brain, diagnosing can be very intimidating. My first year, I was very, very intimidated. I know stroke protocol. If you are having an issue at the bedside, I can react without blinking an eye. However, when I have to have that conversation of, well, I believe your loved one has Alzheimer's, in the beginning, it's very intimidating. And it's like you lose, not lose, you, okay, backtrack, what I want to say. And like when you're diagnosing somebody with Alzheimer's, you feel very intimidated. It's like the imposter syndrome is eating you away,
Mm,
and
mm,
you just want to do education. You just want to do the therapeutic, talking with the family members. You don't want to diagnose, because if you diagnose, it's like your name's on it.
right.
Versus at the bedside, it's like, oh, I can always defer to the physician. I'm just carrying out the orders as the bedside nurse. So that was one of the things that I've heard that they were doing residency programs for nurse practitioners. I'm like, that should be across the board, because my program was family nurse practitioner. So it's like general, like internal medicine. But I've always worked in the neuroscience. So I know the language of neurology. I have a better understanding per se, but I was not trained to be a provider as a neuroscience provider. So it's different when you are a physician, you go for your neurology residency for 4 years, you do your intern year, and then you have 3 years. And then there's like a sequence of educating you.
Right.
Versus me, I had to learn on the job.
Right.
Thankfully, the physician I work with, he's very good. He's well trained, and he practices neurology, to do right by the patient. Basically, we make sure that we are as thorough as possible, and we don't turn patients away. We don't shy away from some things. Even though he's subspecialized, we see it all. So we're very much comprehensive in our
What's so
office.
interesting, and I love that you said that, because because I 100% agree with that sentiment, that it sometimes it is just a different process that occurs when you're the one making the diagnosis, because not only is it making the diagnosis, then you're initiating treatment that comes from you. Like, all right, I think you have Alzheimer's. I want you to do this, this, and that. I want you to take this and that. Versus in the other, first from a nursing standpoint, they're usually on the receiving end of the order, right?
Yeah.
They're usually on the receiving end of like, oh, hey, the doctor wants me to do this, this, and that. Because that's what it goes. Versus now you're the one in charge of not only saying, hey, this is what you got, but this is what I'm going to do for you because of what you got. And you're responsible now to, like, again, reiterate your thoughts, your feelings, your orders to someone else to kind of act upon it. So I 100% agree with that switch that has to occur, especially when you're going from that transition of, and I hate to say just a nurse, when you're going that transition from nurse to practitioner.
Yeah, it's definitely difficult. And then add another layer onto it. I was the only person of my skin type that was in the role. So looking across the room and all of the providers in the room, I was the only Black female provider. And that was very intimidating in the beginning, because I just didn't know, where did I fit? Like how do I operate myself here? Like, how do I make sure that I can convey to my patients and my colleagues that I'm here to do a great job, you know? So that was
More importantly, I belong here. Like
I belong.
this
It took a
this is where I'm
while.
supposed to be. This is where I'm like,
Yeah,
we didn't, like you said, your resume speaks for itself. We didn't just
correct.
luck up into neurology, neuroscience. Like I've been doing this.
Correct. And then as I look around the room, it's like, so who can mentor me? Like, I don't see anybody that looks like me that can mentor me. And it's like, okay, not only am I part of, you know, the Black community, I'm also part of the women community. So all these marginalized groups that, you know, it's like,
And then I'm pretty sure as a higher you go, and I definitely know I experienced, especially when we were in school together. Like our class, I've said this before on this show, our class was we had 7 of us out of like 200. And they were like happy and giddy that it was 7 of us. They're like, wow, 7 of y'all. Like it was like a thing, like, because that's how before it used to be maybe 1, maybe 2. Remember, again, 200 plus people. And so I can only imagine as you're going from the ranks, because at least visually, and I'll let you expound upon it. When I look at the nursing, right, you don't really have that issue of lack of women, right, in that profession. You don't typically have that issue of lack of Black women in that profession. Correct. So now you're moving up, the ladder, and you're seeing less and less of people who look like you, who could probably share some similar cultural experiences with you.
Correct. And then tapping back into, I'm first generation here, so I can't even look towards my parents for guidance. And now I can kind of like look back of, they just always just pushed us, go to school. Of course we joke in the Haitian community, become a physician, a lawyer, engineer, like those are the only degrees. However, they don't know how to guide us.
Nope, at all.
They just say, go do it and you figure it out. And I never was like, oh, there's no way I can attain those things. Like, nursing is good. And not to, bring down the nursing profession, but it's like everybody becomes a nurse. It's easy. I can do it. Mm-hmm. But then you tap into understanding like your profession when you have a pride in it, like how do you take it to the next level type deal. And when patients ask me, what does DNP stand for? And I'm like, I always joke with them because they're like, oh, you're doctorally prepared. You should be calling yourself doctor. And I'm like, it's a little convoluted because you may understand, but not every patient understands. Mm-hmm. So I always just say, my name is Kettia. I'm your nurse practitioner today. However, it's always so funny when you explain, because if they come in, they see me and they have their preconceived notion of who I am, what I'm about. And then afterwards I speak and then they ask me about my title or not, my credentialing, I should say, not my title, my credentials. Then they're like, oh, okay, I see where the doctorally prepared comes in. Mm-hmm. It's like,
do you ever feel self-conscious about announcing yourself as the doctor? And like, is that, and two questions. Do you feel self-conscious, and does that self-consciousness usually come when you're speaking with the patients or when you're speaking with your colleagues?
So in the beginning, now not as much, because I have created a foundation. I understand. And then what I don't understand, I acknowledge, and I know how to find the resources. However, in the beginning, it is very intimidating, and trying to, say that, hey, by the way, I do have a DNP. It is very intimidating, but it does take time. And I guess too, it's because I come from, my characteristic is not to boast, it's to be modest, which that's a whole nother conversation.
Which I can tell you as a doctor, right? Sometimes it does hinder us because people will play you.
People will play you. And then
you know how we talk on here, Lunch Community. People will definitely try to play you.
Yes, they, my upbringing was to be modest, put your head down, work hard. So tapping into the confidence and learning that, you're not going to be perfect all the time. You will make mistakes, and that's fine. As long as you do your best and you're honest. If you make a mistake, you just acknowledge it. You try to rectify it the best that you can. However, in the beginning, it was very intimidating. And I was very in the notion of I need to be as modest as possible. I need to be as quiet as possible. I'm not boisterous now or like overly arrogant or anything. However, I do let the patients and family members know, like, I am an important part of your treatment plan. Yep. Because I'm the provider that will advocate for you. Because as the role of the nurse practitioner working alongside with the physician I work with, I'm always thinking, yes, the science is very important, but how do I make it accessible to the patients? Mm-hmm. Doesn't matter your economic status. I want to make sure that the latest treatment that's appropriate for you is accessible to you. So with gaining that knowledge, gaining that understanding, I've become more confident. And now I can proudly say I'm a DNP, but in the beginning, it's very intimidating because it's like, you realize that turning from the bedside nurse to a provider, like, it's like, okay, I'm here, like I'm expected to perform and figure out all these things that I didn't go to med school. I don't understand. Like, there's a different foundation that my boss has versus me. So now I'm more comfortable saying I'm Dr. Kettia, I'm DNP. In the beginning.
And what I tell all the patients who I come in contact with, even though I have my medical degree, like, one of the best things about any practitioner is knowing, hey, what you know and knowing what you don't know. And you can be 1 year in the game, 10 years in the game, 20, it does not matter. If you get to the point where you start acting like you know something you actually don't, the person who gets hurt will always be the patient. Like, your ego got to be put to the side when you got to be able to step aside and say, like, nah, I don't know that. Like, I remember I was a resident, and I shout out to Miss Louise, because she was the first person to teach me how to treat a patient with DKA. I ain't know nothing. Again, I'm an intern. I ain't know nothing about DKA. I just knew, all right, I got to do something. And she was like, hey, Dr. Pierre, I got you. Like, this is what the doctors always do. They do this, and I'm like, oh, okay. I'm just writing out everything. And she was a nurse. She was an ICU nurse, because we all know ICU nurses are crazy smart. She was an ICU nurse, but so imagine if I had a level of pride where I like, oh, I'm not going to learn from a nurse. Like, my patient is going to get affected. So I always say, like, that tells me everything about a person when they're able to recognize what they know and what they don't know and who to get it from. Because I'm an internal medicine physician. I get consults all the time. because I don't know everything, and I know I don't know everything. And once it gets to a point, and as an internist, I know a little about a lot, but I know what I don't know. And that's when I go call in the experts, say, hey, I got the stroke patient, got the seizure patient, got this boom, come handle me. Hey, I got this AFib, come take care of this for me, please. And that is what really makes the next level as a practitioner. Yeah. And I can tell you, because I take care of patients that have nurse practitioners who work under me. And one of the things that I always have to reinforce, and funny enough, sometimes I have to reinforce to the other nursing staff that, hey, that's my nurse practitioner. Like, when a patient may say, oh, I want to speak to the doctor. Oh, my nurse practitioner didn't around. Like, I have to let them know, like talking to my nurse practitioner is just like talking to me. Because if I didn't think that was the case, they wouldn't be my nurse practitioner. So I think it's just as important for the physicians who have nurse practitioners under them, right? Depending on where you're at. Because there's certain states that it's like right here. Like, there's not even Florida's weird. But like, understanding that it as a physician, you also have to be making sure you're going to bat for your nurse practitioners, so that patients, so that other nursing staff, so that admin can't be like, oh, only your nurse practitioner rounded, you didn't round. Like, at least I don't play that. Like, I make sure of that for sure.
And it's hard for in the beginning when you're building that relation, because of course I was very fortunate. Like, my boss he kept it, what I felt like in the beginning, it was like a training, you know? So how when I was doing my preceptorship, you go in, you assess the patient first, you think of, you formulate your differentials, you come back out, you present it. So he kept that same format with me for a while. Now he tells the patients, no, talk with Kettia. Talk with Kettia. He can rest assured that, he's confident that I have a good basis of what's going on and I know how he thinks. So
that's an important thing. I love that. I know how he thinks, because a lot of times it, like, once y'all are in our back pocket, it just makes things so much easier. It's like, oh yeah.
Yes, it's the truth. Because he's like, no, just she knows. It's okay. It's okay. Don't worry. He's like cutting the umbilical cord for the patients. It's like, it's okay. It's okay. She understands. Recently, I was by myself in the office because he was out of the country doing his medical mission. And patients typically like, no, I'm going to wait for the physician. It's like, just going to let you know, it's going to be a while, because when he comes back, the schedule's already booked. So patients coming to see me now, and they're like, oh, we were so used to seeing you both, but I can just see you. It's okay. It's okay. Because, you talk with me. You ask to see how the grandkids are doing. Mm-hmm. So it's so funny, that shift. So, but it takes time. It's not overnight.
What are some interesting cases? What are some of the, especially obviously you've seen it at so many different levels, but like, what are some of the most interesting cases that you like come in contact with?
Our paraneoplastics are always the most interesting. Because all of neurology is so interesting. I
love it. I love that answer.
All of neurology is interesting. I mean, because we're very comprehensive. We don't shy away from things, but I think the most interesting things that are going on right now with Alzheimer's, there's new amyloid beta targeted therapy that's on the market. Well, it's FDA approved, but Medicare is not covering. We can do a podcast just on that.
Lunch and learn community. When you hear that phrase, that's So
there was a lot of things that have occurred, and I'm trying to figure out how to create content to educate patients, because what's interesting as a provider too, and as a minority provider, when new things come out, new therapies, and you're looking at the prescription information, and which is the what the clinical trials were, and you see that population and you see like 2% Black, it's like, I know it's layered. It's our love and hate for the medical world. I get it.
Yes.
Tuskegee was real.
Yes.
OB, they were not giving any sedation. I get it. The whole pain.
Henrietta Lacks. Like we could run down the list and it's there.
But we have these healthcare conditions too.
Yes.
So it's always interesting of how can I tap into, because I do work in an affluent community, which has the resources, the economic resources that are not for the everyday person.
Mm-hmm.
So they may pay cash for a medicine that I know, like my family member wouldn't be able to, because we just don't have that, So what I find interesting is how can we make it more accessible, and knowing how to maneuver. So when the pharmaceutical reps come and they're getting ready to launch a program and they're asking our take on things, and it's like accessibility, like thinking of how do you try to enroll, how do you try to engage the marginalized communities, So with Alzheimer's, going back to that, they're doing some post, because it's on the market. So it's like post-market clinical trials, and try to enroll more minorities. So right now it's like Blacks as well as Hispanics. We want to try to enroll as much as possible to further understand, because that's the exciting thing about neurology, is there's a lot of unknown. When you think about Alzheimer's, you think about Parkinson's, neurodegenerative disorders, it's like you may have the pathology, but that doesn't necessarily mean that's going to translate to you having Alzheimer's. Just because you have amyloid beta proteins doesn't mean you're going to have a memory issue. Or your MRI of your brain, when we look at it, could look pristine. However, you're not cognitively there.
Wow.
So lots of interesting things. I can't really say that there's one. We've been doing some CTE cases from former NFL football players. So that's another conversation in itself too, because what therapies do we have for them? You know, that I know the NFL has a new initiative that they're doing, a big initiative that they're trying to capture because of all the legal, you know, backfall that's happened with that. There's so much. There's multiple sclerosis. There's stroke is always going to be a favorite of mine.
Stroke is always there. I think my neurologist, I always say that the neurology team, especially just in medicine, has the best physical exam.
Oh yeah.
The most detailed physical exam. Like we joke about the surgeons who like they don't even carry a stethoscope because they're not touching their patients. But when you look at the other side of the spectrum, like the neurologists and what they're able to ascertain before they do a lab test, before they do a study, anything, just by being able to look and evaluate the patient has always been one of the most amazing things that I've like loved about the field of neurology, how they're just able to be like, oh, okay, all right, like that, oh, it's probably that area there. Like, and I'm just, even now.
You have to localize the lesion. That's the biggest thing. You have to localize the lesion. So if your assessment is not matching up, the patient comes with a chief complaint of something. The assessment, you use your tools that you have, your reflex hammer, your tuning fork, you know, and if it's not adding up, it's like, okay, now we need to add in the diagnostic, you know, your imaging or your EMG, whatever the case may be. But it has to be so. And then two, within the neurology realm, a lot of our medications are super expensive. So these insurance companies, they want you to be as accurate as possible. What is your significant findings on your exam? Then that would get the approval. Going back into the whole accessibility, you know, topic, but it's very important in neurology. You have to localize the lesion. Like it has to make sense, because then you could be missing something. A patient can come in and say, I have blurry vision, and it's not really blurry vision. They have a visual deficit, like they're missing half of their vision in both eyes. Right. And it's like, oh,
they just compensated and just assume that it's just a blurry.
Yep. And they just, this past week, the guy was like, oh, he came back to us. Originally, he was seeing us for lower back pain. So he has some stenosis, which equals to arthritis to his lower back. And then he's coming for a regular checkup. How you doing? You're fine. You're taking your gabapentin. You did your physical therapy. Any new symptoms? Oh, I have blurry vision. Tell me more about this blurry vision.
Right. I want to know. I want to know.
Like stat MRI, you're having a stroke.
Wow.
So it's like you have to be detailed with your assessment. If not, you can miss a lot of things.
And what I love, and obviously we kind of mentioned it before, and I always typically every time I bring my my experts on the field on the show, is that I've noticed that not only are you keeping, like obviously you're taking care of the patients in the clinic, but you're really doing a much more expedient effort to kind of educate the community at large with what you've been experiencing. Like let's talk about the neuro nuggets, but like let's talk about what kind of led us to like even want to do it, because for a lot of practitioners, they're 100% okay taking care of their patients and going about their day. But it does take that extra step to one, use the internet, use social media to continue to educate a community that they may not be able to physically touch, visually see, but know that their words can get to them. Like tell us a little bit about that motivation just behind like your endeavors in that field.
So my endeavors into content creation as a healthcare provider kind of organically formed. I would joke with my friends that there's a specific scrub company that I want to be affiliated with. So I'm like, I gotta get into doing content creation to get some free gear.
Yes.
But then too, it's I would joke about that, but then it's like when I look around, being a millennial and knowing that this is how the world has evolved. And it's not only in the medicine industry, this is across the board. A lot of people get their information through social media. So, how can I tap into using my skill set to provide education, but not giving medical advice because I'm not your healthcare provider, but also to like kind of educate the nursing profession, those who may be wanting to do what I do and not see somebody who looks like me. So I just kind of organically created it. And right now, still in the very nebulous phase of it, creating content as I see fit. I don't want to mimic another person, which I don't think I am because I don't see anybody
But,
else who looks like.
I can tell you, just as a I guess a long time health content creator, like I'm very keen on the content creators, especially when they look like me. So whenever I see one, I'm like, oh, okay, what's going on over here? Because I'm just interested to see what's happening.
Yeah.
So I can assure you that there's not a lot of people who are doing that education in such a specialized field. And more importantly, and I always say that even if there was 10 people, even if there's 100 people, there's not a lot, there's no one who's doing it like you would do it.
Correct.
And a lot of times, that fear of, I don't want to seem like I'm someone else. I don't want to seem like I'm just using their, but I can assure you, one, there's not a lot of people doing it. And two, no one's going to do it like you do it. And that's why, again, that's why I was so attracted. I was like, oh, yeah, I see the play over here. I can see where that goes. More importantly, because like I said, me and you share a lot of characteristics. I'm the oldest Haitian American. Parents ain't no. My mom worked at Red Lobster. My dad was like a janitor and landscaper. Like ain't know nothing about medicine. They not a clue.
You're gonna become a doctor.
They
you are gonna become a doctor.
Right. They just told me to go. And so when you look back and I always remark, because my father, he passed away and I was a first year medical student from heart disease. Mind you, his son was in medical school. He didn't talk to his son about his heart disease, didn't talk to his son about blood pressure. So I'm like, all right, I can have someone in my immediate family not recognize that they probably need to be talking to someone about their health. Like I can only imagine what it's like for families who look like me just across, the country, across the world. So that was why I kind of said, like, I'm going to do this thing here because yes, I may not, like my dad's gone, but like, I may be able to save someone else's father, someone else's mother, someone else's uncle and grandma with the message that I bring. So that's why I love when I see new content creators come, because I know you're going to be the reason why someone like really takes their vision issues a little bit more seriously next time.
Correct.
What?
Correct. And most people think too, it's like,
I got a stroke.
Yes, most people think it's like, oh, I have vision issues, I'm gonna go to my ophthalmologist and I'll just get an appointment whenever. It's like, actually, you're having an acute stroke right now. Like, we need to figure out what's going on, because it could be a posterior stroke, and let's make sure, like, if you're throwing clots, like, is this atrial fibrillation? Like, let's be as proactive as possible. But going back to what you're saying too, the parents that don't speak to their kids about their health issues, or that's another conversation in itself too.
Yes.
Because I joke with my mom, I'm like, what do you think I do all day? Do you think I'm just like sitting there? So that's another reason too. It's like,
oh, that's too funny.
Comfortable having conversations with my patients. So this is it's a little intimidating, but I have comfort knowing what I do know and how I can communicate that, because that is the most important thing to me. I don't want to seem like, I'm a DNP. I need to use all these big words. Like, how do I make it make sense to you?
Mm-hmm.
Because that's the way I learn. Like, let's bring it to the level that you understand. And when you leave the office, I want you to be able to leave confidently. So I joke with my mom, like, she's like, oh, I'm having headaches. And I'm like, you do know I've always worked neurology. This is like 12 years now. Like, what do you think I do all day?
Right.
So I hope what my journey, my endeavor I can collaborate with different content creators as well as, I envision one day doing like a health fair that
Ooh.
really translates. And it's not like your generic health fair. Like I want the communities to understand that we serve of accessibility and really continuity of care. Because when you think of the grand scheme of like Medicare dollars or healthcare dollars, in a sense, a lot of times it's like, okay, you got that one blood pressure reading and they don't see a healthcare person forever.
Yeah, but
So it's like,
probably till the next time you come around for that.
correct. And it's like, how do you drop that understanding? Like, I'm here for you and I look just like you. And I want you to know that there's resources. So I envision someday, I'll have NIH grant funding where we can do even better preventative care. So how that will come about, I don't know. But I want this to grow as organically as possible. I wanted to do consulting for nursing inspired professionals who may want to join into neurology or just have they want to learn more about the nursing profession, because I've been doing this over a decade. It continues to change, it continues to evolve. It's scary how some of the evolution has occurred. But I'm from that old school thought of like, let's pay it back, because I don't want it to be so far removed where you don't have genuine, like, good care at the bedside. Because that's the scary thing too. It's like, with COVID, people are just like over the healthcare system, running us to the mud. And it's like, how do we make sure that we educate, we promote, we, what's the word I'm looking for?
I think just the love of advocation for
Yes.
for
Avocation, yes.
for that patient, right? It's just,
Yeah.
you said it best for COVID.
COVID, it really took a hit on the profession. And it's not just nursing at the bedside. It's, nursing homes. You have your, like, everyone was affected in the
Nursing
medicine
homes,
profession.
rehab, and again, because I just see all, because I'm at all different levels, nursing homes, rehabs, long, like everywhere has just been like just decimated with, just an absence, or people leaving our profession in droves because they're tired, they don't want to do it this anymore, they rather do something that is not only appreciated and respected, right? Like those two things, unfortunately, I think got sped up in being lost during this pandemic, right? That lack of appreciation, that lack of respect, and then they ain't paying well, right? That's a whole nother discussion. Yeah. Right. And so like all those things that kind of sped up this exodus that I think we're going to continue to see unless something like drastically changes.
Yes. And then when people say that, oh, we have a nursing shortage, we don't have a nursing shortage. You need to, as administrators, understand, how do you retain your staff? Like, actually talk with your staff to see what are their needs and wants. Like, obviously you're not going to pay me the same that you're paying a physician, because I'm not, at the bedside, I'm not generating funds, but I'm the bottom line. You want to make sure that your nurses are trained properly, that they're understanding their protocols, they're working within their scope of practice, and making sure that these patients are staying alive and well, they're not coming out with worse outcomes because your nurses are stretched so far. They're like so spread out thin. And it's like, and it's not just nurses. I'm just speaking from the nursing standpoint.
Oh, yeah. No, I can definitely concur. I can concur from the nursing perspective. And I mean, don't get me started on how they can pay a travel nurse 2 times the amount that your home bread and brother nurse is doing the same job cannot get paid. Like, right. So, and then the bread and brother nurse who's that home base has to train yeah, that's a whole.
And then you hear the CEO is making over $1 million.
Yes.
And it's like,
right.
Things don't make sense. Nope. It doesn't make sense. So what I hope to do with my platform, I have many ideas. We'll see how they translate. But my main focus is making sure that I have a good work-life balance because I'm still very much, working Monday through Friday. I'm a mother of a 22-month-old and I have a husband and 2 dogs. So very busy.
Yes.
And I just, I want to have fun, enjoy my friends, enjoy my family. So, I'm excited for what the future holds. But given that I have this foundation and level of skill set that I can tap into and not necessarily have to do too much work into, it's just the content creation part that I'm excited to see what happens. But yeah, there's so much we can talk about. Like I can come back
Yes.
about
I
Black population,
love
clinical trials, our family being of Haitian descent and family members, they don't take us. It's like, it blows my mind. My father, just a little, transparency. My father got diagnosed with lymphoma at the beginning of COVID. And the Haitian community loves to do their teas. He literally was doing a tea that was giving him like liver failure, did not disclose that. It was just a chaotic, and it's just, we can talk about that too. There's a lot. There's a lot we can bring to the congregation.
You still bringing me back because I had a slip epiphany, which is an orthopedic injury, and they was giving me teas. They was having me bathe in like I was like bathing in tea leaf water. It was, and I was like, Mom, just take me to the doctor. Stop playing like this. I'm young. I had to realize like, Mom, like this not getting any better. You can rub hot oil all you want. Right. And again, that's just more of, again, legendary community. This is a cultural competency, right? This is just, you have to know the culture that you're dealing with, right? Especially when you're talking to certain patients, right? You just have to understand, like, they probably try.
And I'm all for integrative medicine because medicine came from your herbs and things like that. However, you need to disclose that. That's why it's so important to disclose that to your healthcare providers.
Talk to us. That's all we're asking. Just be open. We're here.
And it's like, so then why did you encourage me to go to school if you're going to do your own thing, is what I would reply to them. I'm like, you're doing your own thing. You're not telling the doctor. Like, if I am not part of the conversation, that piece of information that's very vital is not being expressed. And I'm like, come on, guys.
This too.
So I can go on and on.
Yes. No, we're gonna have you back. We're gonna have you back. We love repeat guests here on Medicine Mondays. We're gonna have you back. Where can people follow you? To follow you on the beginning of this content creator journey, so they can just kind of see, watch, and prosper and just do amazing things. Where can people find you?
You can follow me on Instagram at Dr. Kettia DMP. So it's at dr.kettia.dmp. And for now, that's my only platform, but hopefully I'll have a website soon and whatnot. But, you can reach out if you want to collaborate, or if you have any interesting things that you want to discuss in terms of neurology. I love neurology. I get excited when I see persons of color in neurology, especially if it's a Black woman. Oh my gosh, that just melts my heart. Melts my heart. So it's very, because as we evolve as humans and there's more rights and accessibility for marginalized people, it's very exciting to see more representation. So exciting time.
We're here for it. And again, thank you, Lunch Learning Community. Again, please make sure, and obviously the description will be, her Instagram page will be in the description and show notes for my podcast listeners. So you just click away, you head up on the page, make sure you follow her. We are gonna, like I said, we are make sure we bring her back. We're gonna follow her along on her journey. It's gonna do amazing things because we wish it, right? We wish it, we say it, right? So we're gonna just do, right? That's how we do here in our community. We just bless you. Again, thank you for joining our show today.
Thank you. Bye, everyone. See you in the interwebs.